While we were doing our study of on-site testing and treatment for flu in Seattle and homeless shelters, coronavirus happened. And in the midst of the coronavirus pandemic, we were already doing surveillance for all these respiratory viruses in these 9 shelters throughout the city. So we were able to very rapidly then to add coronavirus testing to the testing we were already doing. And by doing that, we were able to look for how coronavirus entered and transmitted in shelters, what were sort of the different types of environments where we would see more coronavirus versus less coronavirus. And then we implemented a strategy where once a case turned up in a homeless shelter, then we did massive testing of the entire homeless shelter in collaboration with public health, which we called surge testing. And the goal really is to use this as a model for other populations that have to live in closed settings. So if you think about refugee camps or prisons or any place where people all have to cluster together and share living space, we thought that doing this type of study in a homeless shelter would be able to give us that information. I think the homeless population in general is fairly underserved. They tend to have a lot of comorbidities, so they tend to have a lot of chronic lung disease, and they tend to be less willing to come in for health care. This population where they're at extremely high risk to acquire viruses, to potentially to spread viruses, and also to get very sick from the viruses, yet it's really only by going out into that community that you're able to find it. And I think the important thing we learned is that that people with coronavirus in homeless shelters are asymptomatic. So they can be carrying coronavirus and potentially be part of the chain of transmission, but not exhibit symptoms. And that the best way to find cases of coronavirus is by sampling everybody, is not to restrict only people who have symptoms, but actually to test everybody in the entire shelter. So we had expected when we started doing this testing that we would see multiple outbreaks in homeless shelters just because of how crowded they were and how they had to share a common bathroom and they were sleeping, just 6 inches apart in their mats on the floor. So we expected that we would see many, many cases, and we did not see that. So I think it was a testament to the fact that there was a lot going on at the shelters to make sure that people were being transferred to these other centers and the decongestion was happening. And then also, I think part of it was probably what we were doing, the on-site testing. And I think that one of the main things that probably needs to happen is to expand this type of rapid testing, not just for flu, but for coronavirus into these clustered living situations. Because there are a lot of new tests coming down the pipeline that are designed for on-site testing. And I think these are the types of places where they probably need to be implemented.
In the beginning, it was really important from our perspective and from the perspective of the shelters themselves, the shelter management, that we have conversations with first shelter management, also public health and healthcare for the homeless, like Helen was mentioning, those entities, so they were aware of what we were doing, that they believed that it was going to be feasible and acceptable. People have been very receptive to testing in many ways, and we've of course had people reluctant to be tested, and sometimes, over the course of these past months, we've been able to have longer discussions, particularly the research assistants that have been working so hard in this study. They've really developed relationships and strong senses of trust with the residents and the shelter staff that are on site, and over time they've been able to kind of talk through the importance of being tested and being tested consistently now for COVID. It's hard on all of us, obviously, but it's so much harder on the sheltered homeless population and anybody experiencing homelessness at this point in time, because they're really at a loss of agency and I think and options for if you are positive and you're in a shelter and you don't have the means to appropriately isolate yourself, then what are you going to do?